Hello and welcome to today's webinar, A Playbook Approach to Saving Lives. Today's webinar is being presented by Virox Technologies, makers of rescue disinfectants, and Shelters United. There will be a special message from Shelters United at the end of this presentation, followed by a live Q&A with today's presenter, Dr. Sara Pizano. I am so excited to introduce Dr. Sara Pizano, founder of Team Shelter USA and author of the Best Practice Playbook for Animal Shelters. And speaking of the Best Practice Playbook, we will be giving away copies of the ebook version throughout this presentation, so make sure you pay attention. And Dr. Pizano, I don't know about you, but I can't wait to give out the first 5 copies. So let's kick off this webinar by giving out 5 copies of the Best Practice Playbook ebook to the first 5 people who register for this webinar. So that would be Nathan Schneider,
yes,
Soraya Hijazi, Deborah Allen, Andrew Shaver, and Cecil Torres Castro. Congratulations. I hope you've tuned in today. You will be receiving a copy of the Best Practice Playbook ebook. We will send you an email after this webinar to confirm all the details. So without any further ado, over to you, Dr. Pizano.
Thank you so much, Lara. I appreciate it. And thank you to Shelters United. I'm so appreciative to Virox. If you have seen a hard copy of the playbook, you'll see the Virox logo on there. And that's because I approached them to be a sponsor of the playbook because I so strongly believe in Virox and just think they do such great work, and really grateful to have this platform to talk to you today. So I have been a shelter veterinarian. We were just talking about it before the webinar. I'm in animal welfare about 35 years, and I was a shelter veterinarian, a high volume surgeon, and I was also a public shelter director. So for many of you on this call, I know what it feels like to work in the shelter, to be up against all odds, to have these constant challenges. In 2013, I created a program with an organization called Target Zero. And since that time, I am doing assessments all around the country. So in 21 states. So the blue states are states that I have done assessments, well over 100 shelters now. And I was surprised to find that regardless of where I was, whether it was a rural or urban, a high poverty rate, low poverty rate, every single shelter, public or private open admission shelter, everybody had the same challenges. And I was surprised to see that I was having the same conversations, whether I was talking to the mayor in Dallas, Texas, or McCreary County, Kentucky, population 15,000. I was having the same exact conversations about solutions. So it's important for you to know that we share, and maybe the levels of challenges or depth of challenges or cost of the solutions might be a little bit different, but empirically, all of us in shelters face the same challenges. So when I go into an organization and give recommendations, I use the standards developed by the Association of Shelter Veterinarians, and that's the Guidelines of Standards of Care and also Spay Neuter guidelines. And if you haven't been part of the Million Cat Challenge, please visit our website at millioncatchallenge.org for all the great programs that you should be thinking about implementing for cats. I am a huge fear-free certified fan because I realize that this is really why this population of homeless animals and their care and their comfort has been the reason that I even became a veterinarian to begin with. So Fear Free now has free certification for shelters. So if you are part of a shelter or a nonprofit in animal welfare and you are not yet certified, please do the training immediately. I did it a couple of years ago. I'm, again, a veterinarian for decades, and I learned so much. So please visit fearfreeshelterpets.com. And then, of course, the Human Animal Support Services is a new organization born out of the pandemic, really linking all of us to these amazing best practices. And after all those assessments, I thought, geez, I'm writing the same report, I'm saying the same recommendations. Why don't I just publish the book? So that's what I did. I published the Best Practice Playbook to outline those core challenges and what the best solutions are. And they start with the foundation that I'm going to go through each of these high-level steps. But if you are not aware of the Human Animal Support Services, or HAS for short, please visit the website, because the best thing I think that they've done, well, they've done a lot of great things, but one is compiling all these resources in one place. So if you thought, geez, I wonder what other organizations are doing with adoption contracts, I wonder what this SOP is in a lot of shelters, you can go on and look at this database that's amazing. So it's humananimalsupportservices.org, and under resources, you can find just endless number, whatever question you have, lots of great blogs and webinars as well, and totally in sync with the playbook. So when I would do assessments, I thought, what the heck? I mean, I'm just going in. I'm not a funder. I don't have any money to give them. Are they going to listen to these recommendations? And if they listen, are they going to work everywhere? And what I found in these numbers are, gosh, from the first 4 years of my consulting work. In the first year, those shelters that I visited, this was just 18 shelters, there were 47,000 less euthanasias the very first year after the assessment. And these are shelters that weren't tracking that way. So I think that this is amazing for several reasons, in part because, again, I always thought you needed money to do that. You needed money to stop euthanizing or implementing these programs. And it turns out program design is the most important thing. Euthanasia is a giant part of this picture for sure. We never want to euthanize animals who could be saved, but that's only part of the story. When you look at these foundational pieces and set your organization up for success, then guess what? Your intake decreases. When your intake decreases, you have more time and resources to have proactive programs, shorter lengths of stay to get animals out of the shelter. So euthanasia is quite important, but only part of the story. I'm going to skip that slide. But I think the biggest challenge that I face, and it's sort of funny, I always wish I should probably tape record people and then show, I could show a series of 150 municipal leaders with the same exact response. They have the same concerns, the same questions, the same fears. And so because of that, I do a lot of reading about psychology of social change and positive psychology. And what I learned over and over is that our human brains are set up for fight or flight. So we are automatically going to trigger for the worst case scenario. We are automatically going to think the negative. So if I made a recommendation, here's what you should do at intake, everybody's going to trigger to why that's not going to work. You could have 100 amazing people interacting with those people during your day. But if you have one kind of not so nice person, you're going to remember that. You're going to go home and lay in bed and think about how annoying that person was. But our own fears and that trigger to the negative has really been a barrier to life-saving in our shelters. And so I want you to keep this in mind. As I'm speaking, your brain will naturally trigger. Oh, that won't work here, Dr. Pizano, because our community, ... Sorry, there's animal lovers in every community, but guess what? I don't expect your municipal leaders to be animal lovers, so I'm going to talk to them in their language, and we'll talk about that. But remember, I am the only one that have had the experiences that I have had, and you're the only one that have had the experiences you have. I call that our microcosm. So when we respect what our history is and what someone else's unknown history is, we can really communicate much more effectively when we carry that respect with us throughout our work. And this has very much to do with animal welfare and with sheltering. The capacity for care is the single most important thing about sheltering. Number one, I've worked extremely hard to keep animals out of the shelter, but if they do come in, we better make sure that we have the resources to care for them appropriately. And don't just think money. What is this? Do they have the appropriate space? Do they have humane space in the shelter? Do I have enough staff to care for them? Do I have medical care when they're suffering? Do I have people like volunteers to help do laundry and give them soft blankets? All of those things are resources. It's not just money, it's a lot more. So we have to make sure the number of animals coming in balances the number of animals going out, and the length of stay, or LOS, is the fulcrum, right? So that's the thing, the variable that can make or break this system. And this is my dog and cat from about a decade ago, but I want everybody, all pets, to live like they did, sleeping together on their giant bed in the kitchen, right? But we are up against a traditional system that is, quite frankly, flawed. It was not designed for life-saving 150 years ago. It was designed to get stray dogs off the street who had rabies, and it was to warehouse them. So we still are suffering in this system when we have no barriers to intake and we have a lot of barriers to live outcome. Thankfully, the pandemic really forced a lot of shelters to look at how they were doing business so that they could balance that formula when they had to close down during emergency situations at the beginning, middle, and still with COVID. But what I want you to remember is, and think about my dog and cat, and think about your dog and cat. Would you like your pets to stay in any shelter? So it's stressful for them no matter what, no matter how hard we work. We all work ourselves to the bone to make it a comfortable experience. But guess what? It smells weird, it's noisy, it's scary, it's stressful for animals. Therefore, it's stressful for people. When we have long lengths of stay, we get overcrowding. Now we're rushed. Now we don't have humane housing. Now animals are exposed to more infectious disease, or, God forbid, injuries from kenneling too many dogs or cats together. Decreased life-saving potential, and what I think is most important, reactive use and waste of resources. And that's where we have great opportunity to change. We also have to remember our brain psychology. We're always triggering to the negative. So if I said, you should do X, you're going to say, well, we can't because of. But really, you are more in control of your shelter environment than you are not in control. So there are a few things like natural disasters and a pandemic that you can't control, but everything else, there are layers of decision makers that can make or break what happens in your shelter. But being over capacity really eliminates any kind of ability for us to provide that fear-free environment. So when we have animals come into a shelter, we don't want them trembling. We want them to get good sleep. We want them to be able to rest. We want them to be able to play. But when we're over capacity, when we exceed our ability to care for them properly, we have no chance to provide that fear-free environment for them. And this is my dog Potato, adopted during the pandemic, so cute. Thank goodness she's quiet now, but you might hear her during this presentation. But it is the strategic use of resources that I found was the biggest, most glaring issue in every single shelter that I visited and helped. That resources were not used appropriately. So they might have had money, but they weren't spending it in a strategic, proactive way. And instead of saying, like, what do we have and how can we use these resources most efficiently, it's always, well, we don't have, big enough staff. We don't have a big enough shelter. Well, we're never going to adopt our way out of this, nor should we try to bring animals into the shelter. We want to work smarter, not harder. And number one, if you don't remember anything else, remember that we want to use the shelter space as hallowed, sacred ground for animals who have no other opportunity, and that will help us provide the fear-free environment. That will leave us with true euthanasia only, which I define as a large, dangerous dog who cannot safely be rehabilitated, or medical cases beyond hope. And also remember that way back when, decades ago, when I started, public shelters were euthanizing most of the animals. So we set this goal of 90%. Some people use the term no kill. I choose not to, but this benchmark of 90% live release rate, it is very arbitrary. And we now see, now that we're on the other side of the rainbow, thank goodness, and we're doing so much better than we did back then, what we see is shelters could be euthanizing those categories, large dangerous dogs or medical beyond hope, and maybe they're at 75% live outcomes. So be very careful using those terms. It's important to educate your community so that you can get support from people, and you don't want them ingrained and triggering. It might not. These are animals that need to be euthanized, medical beyond hope and dangerous that have no hope of rehabilitation. And it starts, this is Potato on her adoption day picnic, adoption party picnic. It starts with responsible public policy. And if you're in a private shelter, you might say, oh, well, that doesn't have anything to do with us. We're a private nonprofit organization. And I submit to you, it has everything to do with you, because you have to abide by local ordinances. If you're taking in stray pets, you have to abide by a stray hold. And that can, again, increase your length of stay and all those negative consequences, right? So when we look at our public policy, and there's an entire chapter in the Playbook on legislation that I hope you will read, there's charts about here's what to put in an ordinance and here's why, and here's what not to put in an ordinance and here's why. Remember, your ordinances always have to reflect state law. You can't be in conflict with state law. But in any event, when you're trying to influence municipal leaders, you want to speak their language and remember and respect their microcosm. That means they want to deliver good constituent services. They don't want complaints. They need to balance a budget, and they certainly don't want to waste taxpayer dollars. They have goals. You need to walk into a meeting with their goals in mind and speak their language. And that's how you get these ordinances revised. It's been infinitely more easy than I ever thought possible. These are just a few examples of when I read and redline ordinances. I don't want to see any breed-specific restrictions, of course. Pet limits are useless. There should be no holds for any cats or puppies under 5 months, no felines or puppies under 5 months, and provisions, of course, for community cats. We want to give people an incentive to sterilize and vaccinate their pets when they reclaim, in particular dogs, because cats, we know, for the most part, are not reclaimed and should be part of a community cat program. But in general, just look at any barriers to life-saving that have nothing to do with public and animal safety, right? So that also ties in to what your field officers are doing. ACOs have to abide by whatever's and uphold the ordinance. So when you change the ordinance to a more proactive mission, then your ACOs can be more in line with a life-saving mission that also provides public and animal safety. If you've never read about the Santa Cruz County Animal Shelter in California, you really should read Todd Stussey's work. Really amazing how they just said, we're just tired of going into these same neighborhoods day in and day out, and we think that we can do some proactive work. So that's what they did. Their ACOs rotate, and they went into these neighborhoods with high intake rates of stray dogs and cats, and just to see how they could help. And they subsequently turned all those areas into low intake areas. This, I don't believe our sheltering or animal welfare system can be successful without our community, without partnerships between public and private organizations, period, end of story. Has to be a community effort. One is targeted spay neuter, and that means I'm going to have municipal money. I'm going to raise money through nonprofits and donations. I'm going to make sure my community knows about this access to spay neuter. Some of you don't have this in your community right now, so this should be a goal to have targeted spay neuter subsidized for those people, in particular fixed income pet owners. That's a very important key group, because we know from Peter Marsh's research that most of the animals going into shelters are from fixed income pet owners. And when we help subsidize spay neuter of those pets, our intake decreases, right? Other important categories are high intake areas, large breeds having those giant litters and harder to save their lives when they enter a shelter, and community cats are going to be talked about separately. But logistics and funding look different in each community. It could be, there's communities where the municipalities give hundreds of thousands of dollars to this program. Some give none, and it's all raised privately. Who does what might look different in a community to community, but remember, it's all about partnership. But this is the best investment for everyone, for municipalities, for private organizations, for animal lovers. When I donate, I'm going to donate to targeted spay neuter, because this is what happens. This happens to be Jacksonville, Florida. This is the number of targeted surgeries. This is intake, and this is euthanasia at the local shelter. So a direct inverse correlation when you do those targeted surgeries. But look at this. This is Waco, Texas. This graph looks exactly the same. Increase in targeted spay neuter. And by the way, Jacksonville and Waco and Huntsville, those municipalities all contribute to targeted spay neuter and subsidies because they see the benefits. Decrease intake and euthanasia. Now in Huntsville, they don't have high volume spay neuter clinics. These surgeries were done by private veterinarians, and it took a little bit longer, but they saw the same trends in decrease. So we want to think about what we can do at the community level before animals get into the shelter. So like in the field with our ACOs, targeted spay neuter. Then we have to say, well, I want to use the shelter, like a lot of shelters pivoted at the beginning of COVID. We only can take in X, or we have to close. We have to figure out how to manage intake and only take in emergencies or what have you. And the goal for an open admission, say, public shelter is decreasing intake. What this might mean for a private shelter that previously was open admission is, I'm going to see how I can exhaust other possibilities before shelter intake, so I can reserve my precious space to help animals that didn't have any other options. So for a public shelter, yes, you might see a decrease in intake, but for a private shelter, maybe you're going to see an intake, but it's a self-imposed intake because you stayed within your capacity of care. We can only do that when we're thinking about all these other options. How can we help them through safety net, medical care, foster care before they come into the shelter, reserving true emergencies and enforcement cases for the shelter. So remember, the traditional system was the opposite. Everybody floods in and now we're in trouble. So this means I'm going to remove barriers to live outcomes so I can keep that capacity for care formula balanced. So why would we do this? I can promise you, when I started as public shelter in 2005, holy cow, I I didn't think anybody wanted to keep their pets. And I was very humbled when the ASPCA and others came out with studies starting in about 2015. This one showed 80% of the pet owners didn't want to surrender. They just needed help. So now we know better. We just want to say, what can we do to help you keep your pet, or maybe help you place your pet into a direct home? I don't have time to talk about Open Door, but you can read about the Open Door model online. This is an access to care model for community clinics that is really going to start making a national impact in 2022, and I'm really excited about that. So with managed admission, when we did the assessment in Brevard County at the sheriff's office, we said, listen, let's try that. We want you to try this. And they weren't too keen on it. The sheriff is an elected official. He was nervous about it. But look what happened, y'all. 80% of the animals were helped instead of coming into the shelter. That was year one. Guess what happened? Year 2, 3, 4. 80% of the owner surrenders that were calling to surrender got help in other ways. Amazing. Jacksonville, Florida, another thing we never did. Those Good Samaritans are coming into the shelter because they found ... And we never asked those people if they could help. So when Jacksonville started asking people if they could help and instead foster those animals, instead of taking those animals into the shelter, look what happened. The year before the program, 456 animals went into foster. The first year of the program, almost 4,000 went into foster. But I will tell you, they have a robust live outcome system in Jacksonville. So it's not about getting stuck in foster care. It's an avenue through to adoptions. A lot of these animals got adopted directly from fosters, and Maddie's fund showing that that's what happens. Most of the time, the fosters either keep them or find them homes, and that's exactly what we want to do. We want foster to be the avenue to adoption. Direct placements, if you haven't read about home to home, or you're not doing this in your shelter, please look it up. home-home.org. Adopt a Pet Rehome is another direct home placement. And then Dogs on Deployment, I put in there. This is a national organization that helps veterans. But it's just to remind me to tell you, there are lots of regional and local organizations too that might not have anything to do with animal welfare, but in a social services setting, there's people that need help. So you can plug in and partner with them. Managed admission, in my opinion, we're going to get to community cats, but when we do the Good Samaritan foster care, the fosters on deck, the safety net, the greatest impact is on those large breed dogs. We know that large breed dogs tend to have a longer length of stay. They get very frustrated when they don't have the right enrichment. Their mental well-being suffers. Therefore, they have bad behavior in the shelter because of the shelter environment and are less likely to get adopted or placed. So when we do managed admissions, this is so incredibly important. It really affects the large breed dogs the greatest, because now if I have far less large breed dogs coming into the shelter, I have staff and volunteers that can give them the right environment in a fear-free environment. And then for cats, there's nothing like shelter neuter return. Some people call this return to field, which is a terrible name because we're not returning them to a field. This is defined as, instead of taking the cat into the shelter, we're actually making sure they're sterilized, ear-tipped, rabies vaccinated, and giving them their FVRCP and putting them back where they're already cared for. How do I know they're already cared for? And let me tell you, people, when I was public shelter director, I thought this program was crazy. And I said, I don't know who's feeding them. I can't put them back. I'm not going to abandon them. But then I realized the cat's looking at me like, Dr. Pizano, you're a veterinarian and I'm 12 pounds. Does it look like I'm starving? And I thought, oh my gosh, if these cats could talk, they would have some bad things to say about us and our intelligence level, right? So these are cats that are being cared for. They do have a food source. And if you know cats and you think you have a cat that goes in and out, so does your neighbor and so does your other neighbor. And they all think that cat is theirs. But we're talking about socialized or unsocialized. We know that about half of cat owners allow their cats outside. We know that we've been training the public forever to bring cats that are, quote, found outside. It's not really lost. That's why I say that with rabbit ears, to the shelter, right? In the name of, hey, we want the owners to find them. Nobody ever took the time to say, well, what the heck, how many of them are getting returned? And it turns out nationally, less than 2% of the shelter cats are getting reunited with their owners. It is, in my opinion, a scandalous program and waste of resources for any shelter to take in a cat that was, quote unquote, found outside. Because guess what? Cats are smarter than people and they weren't lost to begin with. The other bad news is that 80% of the cats that enter shelters are in this category, and they are twice as likely, they are 2 times more euthanized than dogs in shelters in the United States. So that's bad news for cats. Very few of these cats, and we have studies with hundreds of thousands of cats going through these programs nationally. Less than 1% were too sick, ill, or injured to actually go back. Sometimes they couldn't go back for whatever reason, but for the most part, they could go back. With kittens, maybe you have an empty shelter. Maybe you have fosters that are dying for kittens. Maybe you have waiting lists for kitten adoptions. Maybe you have rescue groups that love doing kitten adoptions. So they're not going to go into a shelter to stay and get sick and exposed to URI and Pamuk and all those things. Maybe the kittens you would when they're socialized. If they're unsocialized, we do recommend returning them because we're unlikely to make them socialized. And we have to think about the numbers. It's a shout out to Pasco County. They and kittenlady.org. They have such great resources about not kidnapping the kittens, leaving those neonates with their moms, and the difference between when a neonate needs to be rescued and then they don't, or when they don't. So we need to make sure we're intervening with people so the cats are staying with their moms where they should be staying. And all that information should be on your website. It should be front and center pop-up, especially during the spring and summer. But this system that we have never done before, decades earlier, now is really mainstream. It's normal. It's the fiscally responsible thing to do. It decreases intake of cats, therefore the overcapacity, the disease, and all of that. It decreases the number of community cats outside, so there's less negative effect on wildlife. And then when you have less cats flooding the shelter, you have more resources for shelter dogs. These trends are from every single shelter that does this right. These bars represent years. The green is live outcome and the blue is euthanasia. So in Nashville, they started this program in 2014. You can see the immediate decrease in euthanasia and intake, and that's a dramatic impact there in Nashville. Well, look at Waco, Texas. At the time, a 30% poverty rate when we started working with them, dramatic decrease in intake and euthanasia year 1, never looked back. Amazing numbers. And this, when it's done right, this is what absolutely happens. If the trends are not happening like this in your community, the program is not set up correctly. In Greenville, the director, Shelley Simmons, did a financial study and showed year 1, they decreased intake and euthanasia by 2,000 cats, and it was cheaper than taking them into the shelter. I'm sorry, it was budget neutral for them that first year. So it cost the same. So why not decrease intake, decrease exposure to disease and all of those things. Because they did this program and eliminated euthanasia for space, now they have room to portalize their cages. And when I visited in 2019, this was the only kitten in adoptions, the only feline in adoptions, and now he has a portalized cage. Again, millioncatchallenge.org. There is a very in-depth webinar that we did, which I think is one of the best. It's from early 2020. You can go under resources and webinars on millioncatchallenge.org. If you want the webinar, it's about an hour and a half long. You'll get all the details and research and studies. So please check that out if you are trying to convince decision makers in your community or need to learn more. Then, of course, we have done everything we can to keep those animals out of the shelter, dogs and cats, safety net, all those different strategies. But there is a population of animals that will still need to come into the shelter. So we want to make sure once they hit the shelter, we are advocating for them immediately. They are being seen by the public. They are on our websites. Now, again, we wouldn't do your severely injured, your enforcement cases, your dangerous dogs, your community cats that are going to be having surgery and return the following day. But everybody else, we need to advocate for them immediately, because I see shelters with the 5-day stray holds, and those animals are not even on the website till day 6. That means they had 5 days with no potential. Maybe their owners could see them, but listen, 19% is the national return to owner rate for dogs. I already told you it's less than 2% for cats. So most of the time we have to find a new home for them. That needs to start day 1. And you need to be using social media. Now there's no excuse. There's all kinds of great information on Maddie's Fund has tons of great teaching tools about social media. It's not my area of specialties, but boy, there is a science to it. And so you need to be capitalizing on that. And there's no reason not to, because there's lots of gifted volunteers if you can't afford to have somebody designated on your team. Few more minutes here. I'm going to breeze through these slides, but just medical care and disease surveillance with daily rounds is absolutely crucial for every shelter. If you don't have a veterinarian on staff, this is even more important that you're looking for these things early and catching issues early so that you can get those animals the medical care that they need, or if they are too far gone or without hope, then making a euthanasia decision sooner or later to eliminate their suffering. We already talked about the importance of what your ACOs are doing and returning animals in the field, asking those neighbors to foster, which so many of them already do. But in some communities, I've seen ordinances that require you to administer an animal to the shelter when we want to keep them in their neighborhoods. This is a dog who my neighbors brought to me and said, he's lost. Should we take him to the shelter? I said, no, give him to me. I walked around my neighborhood for 20 minutes and found his owner. I actually didn't even find his owner. I found his neighbor, and his neighbor said, I know where he lives. So you don't even have to find the owner. Find somebody who knows the dog, right? It's not that hard. But taking them to shelter, they don't have a good chance to be reunited with their family who loves them. And maybe they just didn't know, or, a lot of times they just gave them a bath, or the gardener left the door open or something like that to the yard, and they got out by mistake. So hold back judgment from people. We really want to get them back to their original homes when they're in a good home. So if they do enter the shelter again and you are overcrowding, you have lost the ability to provide double compartment housing, which is required for both cats. So they have litter box on one side, food, bed, and water on the other, and for dogs. So they should have access to the outside, part of their pen, a comfy bed on the inside. They need stuff to do. It's boring to sit in a shelter all day long, and you wonder why dogs bark. It's because they're bored and they need attention, and they need cats and dogs all need something to do. They need interactive toys. Play groups, I think, are just the best thing to happen in sheltering in such a long time. Dogs Playing for Life and Shelter Play Group Alliance are two of the training groups that go around nationally, but we know that play groups you can even have 9 or 10 or 11 dogs in a play group, that natural play off leash decreases their stress hormone levels. It increases adoption rates. People love to see the dogs in their at their happiest, right? You can get great videos and great pictures, and adoption rates have shown to be increased in shelters that have play groups. And then the barrier that probably drives me the craziest and keeps me up at night is when we judge people out of adoptions. If you have not read Adopters Welcome by the Humane Society of the United States, you need to download it for free right now. It's on animalsheltering.org. It's by the Humane Society of the United States. It's called Adopters Welcome. This was, again, a humbling read for me. And I learned a lot. And that came out, I think, in 2015 or 2016. But this is about releasing judgment and bias and creating a great environment to welcome people to your shelter. There are over 144 million pets living the dream with their loving families. Last year, there was over 4.5 million animals coming into shelters. And a very, very, very small percentage of those were victims of cruelty, neglect, and abandonment. So we need to stop treating potential adopters as perpetrators or suspects, and we need to match them with the right pet and reduce barriers. One barrier is temperament tests. We bring dogs into this very scary, unnatural situation and environment, and then we judge them by testing them with all these different things that challenge their behavior to begin with. So we need to stop judging people and dogs unfairly, and that certainly goes along with breed discrimination as well. So what I'd like you to think about is reimagining your shelter into an animal resource center, and your team is the help team. Your team is the one that when somebody calls, I found a stray, I have a problem with my pet. Hey, let us link you to resources. If we can't provide the resource, we're going to tell you where to go to get help. We're going to make appointments if they do need to come into the shelter. And if it's a community cat, we don't even take them into the shelter unless it's just for spay neuter and return the following day to their original location. But hopefully there's a high volume spay neuter clinic in the community where the cat can just go directly and bypass the shelter. And then when they are in the shelter, remember, and don't forget the direct home-to-home placements. That's really important too. But if they do come into the shelter, we have to concentrate on the shortest length of stay possible. I'm glad that so many of you have opened your volunteer programs back up. It was, I know, really hard during COVID to not have volunteers, but this is a group of people that can change the way your animals are cared for in your shelter. So that needs to be a robust program that doesn't cost you anything. So I want to thank you for listening. Thank you for Shelters United and Virox for having me today. My website is teamshelterusa.com. I post occasionally on Facebook. I'm not that great about it, but you can follow me on Facebook. And the hard copy playbook, if you don't win a copy today as an ebook, is available on Amazon. The ebook is available as an Amazon Kindle. I'm also on Apple. So some lucky viewers are going to win their playbook today, and I'm so excited to get the playbook to you all.
Well, thank you so much, Dr. Pizano, for that amazing presentation. Amazing as always. I know I always learn something new every time I listen to one of your webinars. And I hope everyone has been paying attention because it is time for a pop quiz. So the first 5 people to correctly answer the question, what did Dr. Pizano say makes the single greatest impact on large breed dogs by keeping them out of the shelter, will win a copy of the Best Practice Playbook. So we'll give you a few minutes to get those answers in. We'll see who has the right answer. Give it a few more minutes. I think people are thinking, and there was a hint in the chat for anybody wondering. Perfect. It looks like we have the right answer in. So for those of you who said managed admission, the first 5 people who got those answers in, we will be sending you a copy of the Best Practice Playbook ebook. So keep an eye on your inboxes. We will be sending an email out to you shortly. So Dr. Sara Pizano will be coming back on here very, very shortly for a live Q&A. So don't forget to get your questions in. But for right now, we are being joined by Danielle Loughton from Shelters United. So Danielle is a member consultant at Shelters United, and she will be giving you a very, very brief presentation about Shelters United. And after Danielle's presentation, we will be rejoined by Dr. Sara Pizano. So Danielle, over to you.
Thank you, Lara, and thank you, Dr. Pizano. That was awesome. A great presentation. A little bit about me. I am a member services consultant for Shelters United. I am also a registered veterinary technician of 25 years. I have spent the last 18 of those years as a sales rep working in various roles. I have worked as a equipment sales rep for Midmark. I have worked as a surgical instrument rep for Securos with MWI. I've also worked in the animal lab sector. And I have two cats and 1 ornery dog. That is a shelter dog too. So actually my cats are also shelter dogs. All right, so Shelters United, we are the only group purchasing organization for nonprofit animal welfare organizations just like yours. You can think of us as a buying group specific to animal welfare organizations. We are passionate about helping animal welfare organizations keep as much of your hard-earned fundraising money as possible so that you can help more animals. With the discounts that we offer, our members saved $1.4 million in 2020. That's an average of $1,857 per organization. What could you do with those extra savings? Angela Stell at NM Dog was able to hire an extra employee with her savings. Some of our manufacturer partners include MWI Animal Health, which is our distributor partner, Impex, who has brought you the programs over the last 35 years, Rally to Rescue, Pet Telethon, Homeless Homer, and more. Sorry, Lara, next screen. Thank you. Sorry, I was supposed to let her know to switch screens and I didn't. Securos Surgical Supplies, Provecta, an affordable option for flea and tick preventatives, Rescue Disinfectants, the all-in-one disinfectant and cleaner, AWA, the leading organization for animal welfare organizations to find continuing education and networking opportunities, Blue Natural Veterinary Diets, MWI Office Supply, and Verbac with a wide range of products, including medicated shampoos, ear cleansers, affordable options for flea, tick, and heartworm. Next slide. And we know a thing or two about saving shelters rescues money. We saved our members a total of $1.4 million in 2020. Almost $250,000 of that was just on parasites alone. The rest of our savings was on food and treats, pharmaceuticals, cleaning supplies like rescue, medical and surgical products, office supplies, and crates and kennels. Next slide. Oh, hold on. Can you guess how much we saved our members in 2020? Next slide. If you're already a member, I'm sorry, yep, right slide, sorry. If you're already a member, make sure you're connected with your member consultant like me, who can help you maximize your savings by comparing products and pricing. Share your savings statement every 6 months so you can see firsthand just how much you're saving organization. We'll check in with you periodically to see how you're doing and also to share new promotions and partnerships. The more members that we enroll, the more negotiating power that we have to bring you new products, promotions, exclusive offers for our partners. If you know of an organization that could benefit from extra savings, please refer them to our website or drop their name and email in the chat now. And there's another member perk. Consultants are available to do a savings analysis to help you make your hard-earned fundraising money go longer. Next slide. And I'm excited to tell you that we just surpassed 1,000 members. If you're interested in joining the Shelters United family and receiving awesome benefits that we've talked about today, please reach out to one of our enrollment specialists. They can explain the program benefits, provide a custom pricing quote so that you can estimate how much we can help you save on the products you may already be purchasing, and help you set up an MWI distributor account so you can buy all of your supplies in one-stop shop. Shelters United is free to enroll in. There are no minimum purchase requirements, no monthly or yearly spend amounts to hit, and no contracts. Next slide. We also want to give a very special thank you to Virox for co-sponsoring this webinar today. They have put together an amazing bundle exclusive to the Shelters United members. It includes 2 buckets of 6 by 7 inch wipes, 1 gallon of concentrate, 1 11 by 12 inch bucket of wipes, and a refill pack of 11 by 12 inch wipes, which is a savings of 29%. Next slide. And what's even better is that Virox is giving away a free 11 by 12 inch bucket of wipes to Shelters United members who purchase the bundle or any rescue product for the first time. And another way to get a free bucket of wipes is to join Shelters United. New members are eligible to receive a free 11 by 12 inch bucket of wipes upon enrollment. Thank you, Lara. Thank you, Dr. Pizano. Back to you for the Q&A.
Well, thank you so much, Danielle, and welcome back, Dr. Pizano. So we had a few exciting things happen. Now, we did have a lot of people answer correctly. So instead of just 5, we are going to give away 15 copies of the Shelter Playbook to the people who got the answers right. So, and we have a few more copies to give. So you may have noticed that a poll went live during Danielle's presentation. So the first 5 people to say they guessed correctly that poll question, the $1.4 million, put it in the chat right now. And the first 5 people are also going to get a free copy of the Best Practice Playbook. And again, anybody who won a playbook during this webinar, we will be sending you an email afterwards. So just keep an eye on your inbox for that, and we will touch base with you about getting you those books. So without any further ado, let's get started on the Q&A, because we did have a lot of conversation in the chat, which is always exciting to see. So Amy Jo had a few questions. Now, the first part, why should an ordinance not have pet limits? And what other ordinances, in your experience, inadvertently increase intake at municipal shelters?
That's a great question. And again, there's a whole chapter on legislation in the playbook. So I'd encourage, if you don't win it today, it's all in there for your reference, because I get asked that question all the time. But a lot of ordinances were created and laws were created with the best of intentions. And so in a community, there was always a hoarder situation 20 years ago, and commissioners said, oh, we have to have pet limits to prevent hoarding. We have to have pet limits to prevent X, right? But we know that pet limits are not correlated with hoarding. Hoarding is, there's 2 types of hoarders: psychological hoarding, which is a mental illness, or accidental, which I had 5 cats and now I have 50 and I don't know what to do, right? So person A can have 50. I know somebody really rich who had 30 cats in their house, and of course it was like not a problem. She had maids and all of that. Another person couldn't care for 2 cats. And so the pet limit does not correlate to anybody's ability to care for animals. So very important that it's not in an ordinance. Some things that in terms of intake and that we see that encourage intake in an ordinance might be an ACO has to take, I just read an ordinance yesterday from a community in Texas, that if a dog was found with no license, then it had to just be taken in, or if it was that large, it had to go to the shelter. There wasn't any leeway for options. And they described it as, oh, he didn't have a license, so he doesn't have an owner. Well, we know that's not true. Community cats is a glaring issue. Community cat, I do a lot of ordinance revisions around the United States. And one of the biggest is community cats are subject to the at-large clause. So cats can't be at large. Well, good luck. You might as well try to make the world stop spinning. People will always let their cats in and out. So let's just make sure they're sterilized. That's a more reasonable goal. So those not having provisions for community cats is giant in ordinances. Very important.
And while we're on the topic of community cats, we did get a question from Brenda, who seems to be having an issue with coyotes in the area and was asking, how do you convince people to advocate for indoor-only indoor-only cats?
Yeah. So here's the thing. I see a lot of friends in the chat. I know that a lot of you have already seen the webinar that Peter Wolf and Monica Friedman did recently. It's all around this concept of indoor cats, that we're the only country in the United States that even keeps our cats indoors and in the whole world. So the concept of indoors is not a natural thing, and it's something that Americans decided was vogue in probably the 60s when cat litter was invented. But in any event, remember, there are millions and millions of community cats outside, all in communities where coyotes live. So coyotes are not killing all the cats. Number one, if the cat got to the shelter, he knew how to hide from the coyotes, right? Like, he was already surviving and thriving. Same thing about being in the northern climates. People say, oh, we can't put them back, it's too cold. The cat's probably 5 years old and he's been living just fine, and he's in or out, or he might just stay outside, but he knows how to care for himself. So give them more credit. And then in terms of convincing people, remember, I was one of those people that needed to be convinced. There is overwhelming data and study and research. And the playbook, I mean, honestly, this isn't a sales pitch for the playbook, although it sounds like it. But I wrote trust me, I don't I'm not retiring off the proceeds. It's just, I put in the playbook those conversations that educate people in a way that makes them realize, oh, wait a minute, I can think about this in a different way. And so if you have people that are resistant to change, maybe it's open adoptions, maybe it's, so much information out there that supports that it's the right thing to do.
And it's, Dr. Pizano, you're a mind reader today, because you are just answering questions before I can even get them out. Because we also had a question from Christy who asked, what's your suggestion to win someone over to your way of thinking if they are resistant to change?
Yeah. So again, one of the ways, so when we visit shelters, for the most part, I'm helping shelters who are struggling. And so they've always done things the same way, right? That's the definition of an insanity. You're getting the same results, but expecting different results from doing things the same way. So what I've been really successful at is introducing them to their peers in other shelters who felt the same way. Maybe it was closed adoptions to open adoptions. Maybe it was the community cat issue. Maybe it was a community-minded enforcement team. I introduce them to peers so that somebody can say to them, just like I've said to you many times in this presentation, I didn't think that, right? I never thought to help somebody that was surrendering their pet because I thought they didn't care. And that was it. We're done. They're giving me their animal, and now I have to figure it out. So we all learn and evolve, but it was helpful for me to see other successful programs because it then gives me the confidence that it's okay. It's not going to go south. I can't recommend Haas enough. There's weekly calls on Mondays and Fridays, and you're going to hear all this great information from shelters that were like, we thought this was the craziest thing, but we tried it and it worked bigger and better and faster than we ever thought it would.
That's such great advice. And we do have time for one more question. So let's finish up with a question from Mal, who's looking for your thoughts on adopting out intact dogs for limited new puppies raised by the families for eventual adoption by the shelter.
This is a great question. And if you live in the Northeast United States or the Northwest United States, this is probably your question. If you live in the Southern United States, this sounds like the craziest question anybody could ask. But I understand because I work with all of the shelters all over the country, right? And I don't think we're there yet, but there are some people who are saying, why don't we start breeding? Because people want animals, they don't want, and not breeding, I should say, breeding mutts, if you will. And those conversations are happening in those destination shelters where my cousins in Pennsylvania looked for over a year for a dog and different ones, and couldn't find in a shelter. They wanted to adopt a shelter pet. The problem I see right now is my answer is not yet. Please don't do it yet, because there are so many tens of thousands of animals in shelters in the southern part of the United States that we still can have transport programs with. I'm not exactly crazy about it because it is a lot of money, but until we can get those shelters on board with all these different programs and solving their foundational issues, we need to have those transport streams. So I wouldn't want to send out intact dogs yet. That might be something that we're going to be looking at in 5 years or less. I see that, but I have heard that question come up, and I think it's a good question. And anybody who's having heart palpitations about it, just remember, this is just geographically, we're very different in different parts of the country.
And I did see one more question sneak in under the wire here from Janet. So let's make sure Janet gets her answer as well. But Janet was saying in much of Connecticut, there's actually a shortage of vets, especially vets that do low-cost stays and neuters. So, and it says even if you can find those vets, they tend to be booked out for a long period of time. How do you suggest that they get vets on board to take turns providing those services?
Wow, that's a great question too. It's not just Connecticut. I'm sorry to tell you, it is a very serious national crisis. I was on a meeting just before this talking about this crisis, and we have some solutions that are just kind of Band-Aids, not really long-term solutions, but this crisis is definitely serious and happening everywhere. I think we have no choice but to involve private practices more than we have in the past. I alluded to Open Door. So Open Door Veterinary Collective is actually a program that's launching now. There are 2 test hospitals. One is in Toledo, one is in Ohio, one is in Asheville, North Carolina. And it's a concept that we can have access to care and have a financially viable practice. And so I think spay neuter has to be woven back into private practice because there aren't enough high volume spay neuter clinics. And as you mentioned, to find those surgeons is like a needle in a haystack. So I think that when you have a program that is streamlined for vets, and I have 2 grant programs in Kentucky with hundreds of thousands of dollars every year that we fund spay neuter for cats, and we use service providers that are private practices. And the first thing I did was I didn't tell them what we were going to do. I went to them and said, what would it take for you to be part of this program? What do you need for it to be successful. And they said, we want to be reimbursed $65 a cat. So that's male or female. And we make the reimbursement very streamlined. So we want to make it easy and streamlined for the practice. And we want to make it financially viable for them. Those are the important things.
And that looks like the last of our questions. So thank you so much to you, Dr. Pizano, for such an amazing presentation. And thank you for everybody who tuned in to today's webinar. For those of you who want a copy of the Best Practice Playbook ebook, keep an eye on your inboxes because we will be sending you an email to confirm how you will be receiving those books. We will also be sending a follow-up email with a link to the recording. So definitely keep an eye on those inboxes. And that concludes today's presentation. So on behalf of Virox, makers of rescue disinfectants, and Shelters United, thank you so much for joining us.
Thanks, everyone.